Welcome everyone to the Colorado State University Prevention Extension Cast. I'm Nate Riggs and I'm joined by Dr. Adam Leventhal, a professor in the University of Southern California Keck School of Medicine and a nationally recognized expert in the area of youth vaping, which is the topic of our webcast today. Adam, how are you doing today? It's good to see you.
I'm doing great. So glad to be here.
Yeah. Thanks for spending the time with us. So Adam, we're also joined today by a diverse group of community stakeholders, including university extension professionals from Colorado State University, Washington State University, and Penn State University, some statewide service providers and educators, public health professionals from Colorado Department of Public Health and Environment and Colorado Department of Education, and CSU faculty and undergraduate and graduate students. So I want to welcome everybody else who's joining us today and taking the time out of their day to talk about youth vaping. So before we get to our discussion today on youth vaping, I wanted to introduce you all to the Prevention Extension Cast. So the Prevention Extension Cast is brought to you by the CSU Prevention Research Center and Colorado State University Extension. So grant funding for the series comes from the CSU College of Health and Human Sciences to Dr. Christine Fruhoff, a professor and director of extension in the Department of Human Development and Family Studies, and me, Nate Riggs, professor of Human Development and Family Studies and the director of the CSU Prevention Research Center. So the purpose of the Prevention Extension Cast is really to engage our communities across Colorado in the dissemination of public health information relevant to their daily lives and raise awareness of the opportunity to participate in research with CSU that is based on true university community partnerships. And this is really in line with the missions of both the Prevention Research Center and CSU Extension. So the Prevention Research Center was established to function as a multidisciplinary center committed to partnering with communities to conduct research that can be applied to promoting healthy development across the lifespan in real-world community settings. And Extension links universities to citizens in each state and is one that disseminates research, information, and expertise in accessible ways, kind of like this Prevention Extension Cast, to help citizens use the information to solve problems and improve quality of life. So as you can see from this slide, Extension has a presence in almost every county in the state of Colorado. And this provides opportunity to access invaluable local expertise on the topics that are of importance to their communities. So the Prevention Extension Cast leverages this expertise by asking an advisory board of extension professionals, who are pictured here, what are the most pressing public health and prevention science related topics in your communities. Once these topics were identified, extension professionals also generated each of the questions that I'll be asking our guests. And our first topic today is youth vaping. So here's what the format is. Dr. Leventhal and I will have about a 45-minute discussion on youth vaping, after which there will be a 15-minute open Q&A based on questions that are generated by you, our audience. So you can type those questions into the chat bar on the right side of your screen. Another thing that you can do is you can actually, if you want to, type in that chat bar suggestions for future Prevention Extension Casts. And then soon after the webcast, you'll be sent a link to the Prevention Research Center website where you can find supplementary information, including infographics that then you can download and take to your communities based on our conversation today. Key points from the webinar and any answers to any questions from the Q&A session that we were unable to answer due to time constraints. So with that, it is my pleasure to more formally introduce you to Dr. Adam Leventhal. So Dr. Leventhal is a professor of preventive medicine and psychology at the University of Southern California Keck School of Medicine and the USC Norris Comprehensive Cancer Center. He's an addiction psychologist and a public health scientist. He's the founding director of the USC Institute for Addiction Sciences and the founding director of the USC HEAL Lab. Dr. Leventhal has generated over $40 million in grant funding from the National Institute of Health and other agencies. And you can see the topics that Dr. Leventhal is really interested in studying there: adolescent and adult substance use, co-occurrence of addiction and mental illness, among others. So with that, we will start our conversation. As soon as we unshare our slides. Okay, there we go. All right, let's get to it. So Adam, the first question I have for you is really a kind of a grounding question around
Sure.
what is vaping, and how is it or isn't it different from other similar terms like juuling, e-cigarettes, pods, those kind of things?
Sure, that's a great question. So when I think of vaping really, it's a method of administering a drug, right? And so if we think about the ways in which people use substances, they can eat them, drink them, smoke them, vape them, inject them, snort or insufflate them, and probably also through their skin. So vaping is of interest to the scientific community because it's the newest form of drug administration that we've seen, right? And so that's kind of, I think of like vaping as maybe a verb, right? And then you have what you actually vape. It depends on what you're putting in your vaporizer, right? And so is juuling and vaping the same thing? Well, potentially, yes. Juul is a type of a nicotine vaping product, right? But as I'm sure we'll get into, you can vape cannabis, and actually you can vape other substances of addiction, and even you can even vape something that just has a solution with the flavoring in it and no drugs of abuse in it. So it's kind of a broad term. But yes, when we think of juuling, for instance, or e-cigarettes, we often tend to ascribe those with the vaping of nicotine.
Great. Okay.
Yeah.
So most of us think about vaping and nicotine, and vaping is oftentimes marketed as a safe alternative to traditional combustible tobacco use, like cigarettes, right?
Right.
Is that true?
Yeah, so that's a really good question. We're trying to understand this as a scientific community, right? And so we need to be careful in giving answers to these questions so as to spread like accurate information about health information to the community, but also in a way that is consumable, right? Okay, so this is kind of what I would say, right? So cigarettes are the most deadly consumer product on earth that are, that the layperson can buy, right? So it kills about half of its users if it's used intended as it's intended, right? As a product you use on a daily basis. What makes cigarettes so deadly is that when you light the tobacco on fire, and anytime you heat a substance, it can be any type of substance, right? The higher you get the temperature up, the more chemical reactions are going to happen, and the possibility that you're going to be releasing toxins. And in the case of tobacco, that is particularly the case, right? We also see this with certain meats. If they're charred, that they can have toxins on them. So, but kind of cycling back to tobacco. So the combustion is really important. Now, another kind of technical aspect of vaping is, so when you're smoking something, you're lighting on fire, you're heating it to like this temperature. And I wish I could give you the accurate figure. I'm a psychologist. 600, 700 degrees, something like that, right? Okay. Then you have vaping, right? It's this kind of sweet spot in the middle where you heat it up enough so that it doesn't light on fire, but yet it will cause the substance to aerosolize, right, and create an aerosol, what people often call vapor, right? And because of that, yes, there are chemical reactions that happen, but likely less of them because the hotter you go, the less. Okay, so there are toxins. And then kind of, if you look on a continuum of risk, you have cigarettes over on this end, right? And then on this end, you have air, but, particularly not the air in Southern California, the air in Colorado, right? That's nice and clean. And so e-cigarettes are somewhere in the middle, right? I can't say all e-cigarettes, right? Some e-cigarettes could potentially be more dangerous because of if they're not used correctly, or because there isn't really good quality control, but they're going to be in the middle. And then so in terms of people who've been smoking, the advice is, if you've been smoking a cigarette and you're thinking about using e-cigarettes, well, first try FDA approved medication, try behavioral support counseling. There's kind of online apps that you can get for free that the federal government, the National Cancer Institute sponsor. I believe in California or in Colorado, there is a free quit line, so you can call in and get free counseling. So try those first. Okay, so if you are someone who has tried all those and you are not going to quit otherwise, and you can't envision a life without inhaling nicotine on a daily basis, then vaping might be worth a shot, and it might actually reduce your risk of exposure to toxins that do lead to deadly disease. But we still need more information about the long-term effects. And then with the caveat is that because these products are not the regulation of them, right, as a consumer industry is still developing. So you're not going to be 100% sure what you're putting in your body as of yet. So with all those caveats, there's my complex answer to your simple question.
Yeah, so maybe more of a harm reduction approach to reducing or to combustible cigarettes. Yeah.
Yeah, that's right. And so harm reduction works, right? But what we want people to get off of all nicotine tobacco products. That's like our primary goal, because we know that's what has a clear improvement in your health. But there are some cases, right, where a harm reduction approach, is going to be better, right? It's the best of two alternatives.
Mm-hmm. Yeah. Okay. So what are the physiological effects of vaping? So what does it do to the brain and to the body?
Mm-hmm. Right. So in terms of drug delivery, modern vaporizers, especially those meant for vaping nicotine, and some of the modern products like Juul people have heard of, the effect on the body in terms of the delivery of nicotine into your bloodstream and how fast it hits your brain, we still need more evidence, but it's looking like that it's going to be on par with cigarettes, right? And so we know cigarettes are one of the most addictive products on earth, right? And so the faster and the more drug gets into your brain, if it's addictive, the more addictive it's going to be, right? And so those are some of the physiological effects that could lead to addiction, or on the other side, from a harm reduction perspective, and we talk about harm reduction, we're talking about adults, and usually like middle-aged or older adults who've tried other things to try to quit smoking. But for those folks, then they might experience vaping as a clear replacement, a satisfying replacement, something that maybe the patch may not provide to them, the nicotine patch, right? And there are a number of other potential physiological effects that we're starting to understand with regards to what I was saying earlier about heating the vaporizer liquid and chemical reactions happening and toxins being released, some toxins such as aldehydes, which are carcinogenic, but they may be at levels that are very, very low, especially compared to cigarettes. And so we know, obviously, carcinogens are the chemicals that cause cancer. Now, let me be clear, there is no evidence that vaping causes cancer. However, for us to make a definitive statement on that, we'll have to wait. And we'll have to observe people vaping over decades to see whether or not. But the evidence to date suggests, again, on that continuum of risk, it's going to be substantially lower, but not safer than air.
Yeah. Okay. So, kind of jumping off of that point, what do we know about that recent spike in vaping-related catastrophic lung failures and death?
Right.
Are those related to inhaling some of these superheated chemicals or unintended products within vaping?
Yeah, thank you for asking that question. This is a really important question. A lot of people are concerned, and then the information that health communication about it, I think it hasn't been 100% clear. But let me tell you from my perspective, and I've been following the CDC who's been really studying this and trying to understand what the source of this epidemic is. So I believe the acronym is EVALI, e-cigarette or vaping associated lung injury, EVALI, right? And so definitely Google it, and CDC has some good, they're always updating information as they study this and more. This is the key thing, right? It seems extremely likely, if not, 99% or something, that the major cause of this is a chemical that's nearly always found only in a cannabis vaping product. It's called vitamin E acetate. It's a chemical that the manufacturers have added, and I use the term manufacturer loosely, right? Because people can be doing this stuff in their basement, in their garage. Because again, Colorado might be fairly advanced in terms of regulating cannabis, but still every state in America has a long way to go. But so it's that chemical that appears to cause the EVALI, which is the where people experience severe symptoms. There's in terms of not being able to breathe. There's also flu-like symptoms associated with it, and sometimes it can end up in death. Often ends up in hospitalization. So the key thing to say is we don't have any evidence to suggest that nicotine vaping or vaping cannabis products that don't have this chemical of vitamin E acetate causes EVALI, but we can't say that for certain, right? And it is possible that there are other chemicals, but it is important to note that we didn't see EVALI for a long time, and people have been vaping since 2011, and especially since 2013, 14. So in terms of nicotine, so it's in all likelihood it's related to this kind of this chemical that some recent manufacturers decided to put in cannabis vaping products.
Yeah. Okay. So I've noticed there was a lot of media attention to this at the end of last year, and it's kind of trailed off a little bit. But I saw a recent report that these conditions are still occurring. Is that something that people should still be concerned about?
Yeah. So anytime you put something in your body, right? There's always a risk, and particularly when we're talking about cannabis products and a lot of the nicotine products too, right? This is not like the food industry where you can look at a label and say, oh, this has like 40 grams of sugar in it. I probably shouldn't eat it. This is not good for my diabetes, but I'm going to do it. You can make the choice.
Yeah.
We don't have that. If you look, the only labeling we have now for nicotine as of yet in vaping is that nicotine is addictive. It's an addictive chemical. That's the only requirement. But ideally, you'd be able to see as a consumer all of the different ingredients listed on the back, ones highlighted that are potentially carcinogens and other toxins. So so you need to be concerned, but the key thing is what we have here is for those of you working with patients and people in the community out there, you got to tell them that the only way to be safe about this is not to vape, right? And then particularly if you're talking about vaping a liquid THC solution, if you don't do that, you're greatly going to reduce your risk. Okay,
great.
Yeah.
Thanks. So up until now, we've been talking about vaping primarily in adults, right?
Right.
So why is youth vaping so concerning? Why should we be concerned about youth vaping if it's relatively less harmful than combustible tobacco products?
Yeah, so good question, right? So this is the problem, that it's a spike in the prevalence of e-cigarette use that we really hadn't seen for any drug of abuse in youth in the nation for a long time. I think it might be in the history. I'd have to go back and look, but Monitoring the Future, this national study that surveys tens of thousands of youth across America, the latest figures from that survey and another survey suggest that somewhere and between 25 and 30% of all teenagers vape nicotine. And so 10 years ago, that figure was real small. Like it was below 1%, maybe below 0.5%. I don't know. So anytime you see that's what's got people concerned, right? Now, if we saw 30% of kids were smoking cigarettes, like I will be honest with you, we'd be more concerned. At the same time, cigarettes have the reason we don't see that is because there are federal and state and local protections in place that are much more robust. You can't advertise cigarettes on TV. They're not available in flavors other than menthol. With regards to nicotine vaping products, there are very few limits on what you can put in them and how you can market them from a federal perspective, and often locally too. And so, so there's differences in the health effects, right? One we think is going to have worse health effects. But at the same time, one concern is if we don't kind of get a handle on this, right? Because there's a new Juul, there's a bunch of Juul copycats. Companies are going to be they're going to make products that they sell that are appealing and addictive because their bottom line is they want to make money. So one concern is like, I hope we don't see it, and I don't expect us to, but are we going to see 35% of teens vaping nicotine in 2020? Are we going to see more? And then when you start seeing that, then, it's a broad spanning epidemic. And some of the other concerns about just kind of like the immediate toxicity and the addictiveness of inhaling nicotine that really rapidly hits your brain is that, what we're seeing now today is vaping is the most common entry point for youth these days in terms of getting into experimenting with drugs of abuse, right? It used to be alcohol for a long time and cigarettes, and stuff has morphed, and now it's marijuana and then nicotine vaping. And we know that when youth start experimenting with addictive drugs, and they enjoy the feeling, it's addictive, it's pleasurable, it's fun, then they may be at risk of transitioning to other drugs of abuse. And there's evidence of that, of them transitioning to marijuana, more recently alcohol. So, there's a lot of reasons to be concerned about youth vaping.
So knowing what we know about how the brain develops during adolescence, are there concerns with adolescents starting to use early on in life, maybe compared to someone who might start using later on in life, and the effects on brain development?
Yeah, I love it. Like the expert in brain development who I'm talking to, I'm going to answer this question because he can answer it better than me. So there's evidence that the Surgeon General has made the statement in Surgeon General reports that nicotine can disrupt brain development. And so what types of disruptions? Well, it can create issues with attention and focus and make it harder for teens to do that. It can potentially result in mood problems, depression-like symptoms, and then it may be associated with an increased risk, later in adolescence or into adulthood of, maybe of having a mood disorder or other types of functional effects. And then, the problem there is also, and Dr. Riggs knows this good and well, is that the brain is forming, it's plastic. The brain stops forming and developing for the most part, like into your mid-late 20s, right? So any kind of damage that happens there, it's hard to reverse, right? And so so that is a concern, and thank you for bringing it up, that with nicotine vaping, that we would expect the same with cigarette smoking too.
Yeah. So oftentimes, young people, even emerging adults, they're not primarily aware of the negative effects of vaping or nicotine or other substances that they can vape, or they're not thinking that far down the line in terms of the health consequences of these substances. So what are your thoughts around increasing awareness? How do we do that among our young people to try to prevent them from starting?
Right. Okay. Yeah. What type of messages? So I think here in California, we there are some public health campaigns and kind of mass media ads, and so things like using messages like, "Hey, nicotine is brain poison." Like, I see that when I drive around California on billboards and stuff paid for by the California Department of Public Health. So I think it's important just to let people know that let young people know nicotine's bad for your brain. Like most e-cigarettes contain nicotine or potentially contain other harmful chemicals, and that can cause addiction. And yeah, and there are probably many other ways to go, and we need more people like you to develop the prevention programs for this. There's not really evidence-based prevention programs yet. I've only seen one, and it only has light evidence at this point, just because they're so new. So
yeah. So what do you think about that? Those prevention programs? Do you think that these prevention programs for vaping are going to look much different than prevention programs for other substances, or are the same things that put someone at risk for starting to vape? Are they similar to the same things that put someone at risk for initiating alcohol use or combustible tobacco products? Or what do you think about that?
Right. So I think that yes and no. So what we see is that vaping. So over time, the youth who are smoking and probably drinking excessively, the prevalence tends to go down as we do a good job with prevention, right? And the ones who are left smoking traditional cigarettes these days, those are the youth who really have the most risk factors. They might have a mental health condition, they might live in a disadvantaged environment, they may have like poor parental monitoring, all these things, because we've done a good job saying like, hey, cigarettes are they're going to kill you. And then I think that the message is that a lot of youth out there agree with that, and they think cigarettes are gross. Why would you do that, right? We've done a really good job shifting the tide there. And it's really only the kids left who say like, I don't care. I don't care if it's not cool. I don't care if it's going to kill me. Like, I like smoking. I'm going to do it. And they're going to be breaking rules anyway, right? With vaping, it's just, it's cool. It's normal. It's all these things, right? We're talking more than a quarter, 1 out of 4. And then, I have to go look at the figures, but in middle school, I mean, it's alarming. It's not. I'll have to go. I don't want to cite wrong figures, but there's a large amount of middle school students also vaping, and so I think different approaches are going to be needed. Like, we need a culture shift, so that people don't think of vaping as just something that's harmless and cool. We need to kind of maybe reorient them in the way we've done with other drugs of abuse, and I think this is the problem that we're seeing today with marijuana as well, because perceptions that it's risky amongst teens today are going down and down and down, and so it does make it more challenging, right? When there's your peers, maybe the media and other folks are telling you like, hey, this is not that harmful of a thing to do, right? It's legal. You can get it anywhere. It looks like a piece of electronic equipment, and so I think I leave it up to the people like you, Nate, to figure out the best ways to shift, because I think it is going to be more of a challenge.
Yeah. Okay. Yeah. You mentioned a couple of things around indicators or risk factors for vaping. what are the warning signs that parents can, or the indicators that parents can identify in their youth, or somebody, or even our extension professionals and our
of course.
serving service providers? How do you know when someone might be starting to either think about using or become addicted to nicotine through vaping?
Right. Yeah. Well, okay. So that's a really important question. So the first thing is just talk about it, right? So when you're talking about kind of health issues, of course, if you think it's relevant, but certainly when you're talking about tobacco or cigarettes, you got to bring in vaping, right? In your discussions with youth. But I would argue that if you're going to hit, like in terms of health ed and prevention, like universally, you're going to hit, sexual health, mental health, alcohol, and tobacco, vaping's got to be in there. So that's the first thing, is put it on your priority list. The second thing is, get to know like what the vaping devices are. And so I think at first with Juul, and it's still like this is the case with Juul and other products, it looks like a USB flash drive, right? And so teachers and parents, like, they saw their kid like with this and its computer charging up, like, you're not going to think it. If you see a pack of Marlboros, you're like, oh, hey, what are you doing with those, right? Okay,
Right.
so it is harder to detect, and the same thing goes for the smell of cigarettes, right? And so I was a teen smoker, and I'm washing my hands, trying to get the smell of cigarettes off before I saw mom. You don't have that, right? Although you may smell a fruity odor or some minty odor, to give you a clue. So, but you do need to kind of understand what the products are. I think the second thing is that if your teen is potentially addicted, which there's some data that's we're looking at now that suggests that that's probably not that uncommon. That if they're getting up to out of dinner, right, and they're coming back and they're up and out, right? They're same thing in class. They're not making it through the end of class. They're getting out and coming back, right? It's possible that they may have a nicotine addiction through vaping, and they might be stepping away because of cravings or other types of nicotine withdrawal symptoms. So you'll see irritability, anxiety, craving, sadness. You see that with all different types of addictive nicotine products. Mm-hmm. So it may be hard because you'd be like, okay, well, why is my teen so moody? Mm-hmm. It could potentially be because of that, right? Mm-hmm. And then I think teens have trying to do what's called stealth vaping, which is like, I have my vaporizer right here, and I'm just going, mm-hmm. So just be on the lookout. Like if you're seeing that a lot, right? And then, as many of you all know out there, when you do see that, you don't want to go in, with a judgmental kind of accusatory type of language. You want to kind of be more open, right? Mm-hmm. So that you gotta start the discussion and elicit some kind of back and forth, I think, with teens, open lines of communication. So when you do spot it, right? Otherwise, boom, you shut down, and not going to be vaping like that anymore. They'll be vaping some other way. Right? Yeah. So anyway, those are just some tips off the top of my head.
Okay. So I'm looking at, I see a question from one of our audience members on why are vaping rates so high in Colorado? And you touched upon, and you do research on the co-occurrence of mental health issues and substance misuse. And I know in Colorado, we have high rates of both mental health issues and substance misuse. And I'm wondering, what are your thoughts on, there could be a chicken or the egg kind of situation here, which causes which? And I'm sure, mm-hmm. It could be either way, right? But what are your thoughts on the co-occurring relationship on substance misuse, mm-hmm. nicotine use, and mental health issues?
Yeah, so they are all related, right? And then some of the evidence out there is bidirectional, mm-hmm. right? So, the mental health or the other substance use can come first, or the vaping can come first. I think probably what we're seeing now is that vaping comes first just because it is that kind of like entry first experimental drug that teens are using, right? Yeah, and you mentioned the kind of the high rates. I don't know about I didn't know that the rates were so high in Colorado. I knew that rates of cannabis use were high, but so I'd imagine that it's probably a cultural thing, and perhaps maybe it is related to the mental health and substance use. But if that were the case, you would probably see high rates of all sorts of risk behaviors across the board if that was driving it. But I would venture to guess that there's a culture out there, right? And then just like California, but maybe even more so in Colorado, of like acceptance of cannabis and acceptance of legal drugs that probably is driving a portion of that as well.
Yeah, thanks.
Yeah. Sure.
And I think it was Sheila who asked that question. So thanks for the question.
Thanks, Sheila.
So I think the last question that I have for you before we move to our Q&A session is, okay, so once someone starts to use nicotine, whether vaping or through combustible tobacco use, what are some evidence-based strategies for intervening with that addiction and getting an individual to quit?
Right. So sadly, it's my understanding that the evidence really isn't super duper strong for any type of program to promote cessation of tobacco use, like especially not vaping, because it's so new. No one's really been, the studies may be emerging right now, but even for cigarettes, right? For cigarette prevention, so taking a teen, stopping from ever taking their first puff of a cigarette, those are robust, and there are a variety of different types of resources available that you would be better than me in providing links to those sites for those, evidence-based prevention programs. There are a number of them, right? But for cigarette smoking and helping people quit or vaping, there's really not much out there. And then, just to kind of speak a little bit more to that, it's probably because there just hasn't been enough research on it. There's been a couple of studies that looked at medications that work in adults, and the results are not that promising, right? Doesn't mean that that's, maybe a nicotine patch wouldn't work for a kid who's vaping or smoking. It's certainly not harmful, and there are other prescription drugs which maybe you might want to be more careful with. But yeah, I wish I had more to offer, right? In that sense. And I know there's some questions too about the program, so I'll try to I'll be Googling while we continue to talk and get you that.
Yeah. So I guess maybe a take-home message might be the best strategy for getting people to quit smoking might be to prevent them from smoking in the first place. Right?
Of course, the guy who directs the prevention center says that, right? No, but no, wise words. Yeah, seriously, right? I mean and that's the truth for any drug of abuse, right? Like the opioid crisis, and these drugs, once they hit your brain, it's a very powerful effect. And if you have some sort of a vulnerability factor, it's very, very hard once you try a drug and then you say, I finally feel at peace with myself, or I feel good. And people with mental health issues, right? That's a hard thing to go against. So really, that is wise words from Dr. Riggs. You got to prevent them from trying it.
Yeah, great. Yeah. Okay, great. So why don't we move towards the audience-generated questions? It looks like we have a really interactive group. I'm looking at the conversation that's kind of going on the side of the chat wall. So one of the first questions that we had generated was, and this might be a bit of a challenging question to answer, but the question is around the cost of vaping. And I'm assuming maybe it's around kind of the public health costs, maybe the human costs around vaping, and how costly is vaping compared to tobacco?
That's a good question. I'm not too sure that there's a lot of evidence on that. One of the key issues is so it's probably the important thing is quality of life due to addiction, right? And so for tobacco, we've been studying it for years, and we can come up with statistical modeling to say, okay, well, this is like the years life loss associated with smoking. And if we were to like reduce the prevalence of smoking, we would have, you know, this much of an increase in life expectancy in the U.S. You know, the risk of death from vaping, you know, and we're talking about vaping nicotine, we're not talking about the, you know, vaping cannabis in a valley, you know, may be low. I can't say that for sure until we follow people. And so this might be a quality of life issue. This might be, you know, when we think about mental health too, you know, suicide is an outcome that we worry about with mental health, right? But the prevalence of suicide from people with mental health problems relative to the prevalence of death from smoking your whole life, you know, it's lower, right? But then the quality of life, ability, functioning, you know, that could be an important thing to consider in terms of thinking about the social costs of vaping, and then just in terms of one point that's important to make, and I'll see if I can find the link to it. Just the cost of buying one. There's a product that some of you might be seeing out there called Puff Bar. It's the new Juul. It's disposable. It gives anecdotally a very strong nicotine hit. Got a bunch of flavors. $10. So in California, that's the same price as a pack of cigarettes. So it's easy. You don't need to charge it. You don't need to insert any pods. So, you know, just watch out for that. So, yeah.
All right. Puff Bar, huh? Okay. So a related question to something we were talking about earlier, we were talking about evidence-based prevention programs, evidence-based treatment programs. There's also policy approaches to reducing nicotine use. And one such policy might be to raise the legal age at which one can purchase a nicotine delivery device. What is your perspective on that? Would that be is that an evidence-based way to reduce vaping, or is that something that we should consider moving forward?
Sure. So I think federally, we just the whole entire nation just went to 21 now is the legal age to buy all tobacco products, including e-cigarettes. So it's great, right? And so that should make a difference. It's not the only intervention. Now, in terms of policy, right? You know, I work at policy on the federal level and trying to think about, you know, a key issue is related to flavors and trying to have some sort of a restriction or prohibiting the sales of certain flavors of e-cigarettes, just like we've seen for cigarettes. You can do that at the local level, though. What we're seeing is like all across the nation, you know, towns and municipalities, they're working with their elected officials, and we're seeing it here in Los Angeles as well, to say like, hey, you know, if you're concerned about youth, we know that flavors are an important aspect that draw kids in. And if they had to vape a nicotine product that tastes like tobacco, we're probably going to see like far fewer kids vaping because the likelihood of kids choosing tobacco as their flavor is very low right now. So that's a key, I think, way to get in a very robust way. If you just make it so that there's no products that kids like anymore, they're not going to do it. So I think that's important for people to consider.
Okay. So part of that policy change is dependent upon our ability to engage with our policymakers, right, and our elected officials. Have you had any experience doing that? I think that there are at least some at the Keck School that are engaging elected officials and policymakers in that change. Can you talk a little bit about what might be the most effective strategies for engaging.
Right. Yeah. For the audience, how to engage.
Yeah.
I don't know. I was like, so, we've been blessed and lucky because, being in a university, like one, we basically, we have federal partners who work with us on our tobacco research center. And so they're on calls with us every 2 weeks, which has been good. And then we have people who work with us and advise us at the state level and the local level. I guess, what I would just reach out to them, right? They want to help. So I would imagine each county has someone charged with tobacco control and health promotion, right? For these types of issues. I mean, just reach out to them, call them, email them maybe, and then do it at the state level, and maybe, through, the Prevention Research Center, at Colorado State. That might be a good way, is if you kind of get a coalition of folks together, and then you go, capital's Denver, right? So, head down there and be like, hey, there's a whole community that wants to see change. What can we do? And forgive me if there's already stuff happening here, but and this is already happening, but can we prohibit the sale of certain flavors? Can we put limits on the types of nicotine levels that can be in vaporizers, right? Can we prohibit certain types of marketing? Maybe that we won't allow, marketing, billboards or other types of ways. So those are kind of some of the approaches that I think people could take. And then, if there's kind of a grassroots effort, which you kind of have going on here, then I think that's a good way to start. And then, and also you got our colleague, John Samet, the Dean of the Colorado School of Public Health. You might work with him too. And so if the whole entire School of Public Health and all of its campuses are kind of trying to push, it might be hard to say no to.
Yeah, great. Thanks. And thanks, Mandy, for letting us know that the Colorado Flavor Bill Committee hearing is next Wednesday. So that's great to know. So a couple of other kind of specific questions that have come through. One of the questions was, has anyone researched why youth begin vaping? And I think you might have touched upon this at certain points in our discussion today, but what is it that is so enticing about vaping?
Mm-hmm. Yeah, it's not that different from what we see with other substances, is that you see your peers doing it and it looks fun, or your peers are doing it, they're going out to vape, and you're kind of being left behind and not being included in the social activity. And so some of the influences I think are common that we see with other risk behaviors, but they're also things that are specific to vaping. Like we were saying, is like the flavors. It just sounds good. Like I want to like inhale something that's minty and tastes good and gives me a buzz, or cotton candy or something, which has no calories, right? But you can just kind of inhale it. So the product is inherently appealing. They also look cool, right? So I think it's gotten to the point where cigarettes don't look cool anymore. People look at a pack or they look at a cigarette stick and just not really appealing. But you have this other thing that looks like a flash drive or like a little like a Apple accessory. There's some intrigue there. So I think, and so the research suggests that, like, teens will say that, my friends do it, and that predicts whether they'll go on to vaping. They'll say like the flavors are interesting, and then that predicts whether they go on vaping. And I saw someone had earlier mention the vape tricks. So where teens will basically inhale a bunch of nicotine vapor or maybe other types of vapor, and then blow out a big cloud, and you can make stuff that looks like very thick smoke. It's like it's like the old smoke rings, but like times
Yeah.
100, right? And so
Mhm.
kids have a lot of fun doing that, making designs with the clouds, and they do. So I think that's another thing. We used to see that like 3 or 4 years ago, and maybe it's still popular, but as an important driving issue. But I think what we're also seeing is just the nicotine addictiveness is a key thing too that keeps kids vaping with the modern e-cigarettes.
Okay. Thanks. And then Chris just typed in, how long does the effect of vaping last in the body? So how long is the high?
Yeah, so it's very similar to cigarettes. So it'll hit you instantly, right? Within 1 second, like anything that you inhale. And then, let's say you were to vape, let's say 15 puffs or 10 puffs. Depending on how long you've been vaping, right? Like, of course, you have a tolerance, you don't. But let's just say that you've been vaping for a while and you have a tolerance to the drug. Maybe 20 minutes, and peak. This nicotine will still be in your bloodstream. It won't be cleared out, right? But then you may not feel like a strong effect in terms of the addictiveness and the psychoactive effects, right?
Okay, great. Well, I think that does it for our audience-generated questions. So I just wanted to give you the opportunity, Adam, if there are any last kind of take-home messages that you would give to our stakeholders that are online with us today. I just wanted to see if you had any closing thoughts.
Yeah, right. Oh, good question. I didn't prepare for this. Yeah, I mean, closing thoughts. I guess. Okay, so this is go like really big picture. The more and more I study addiction, the more and more I think about addiction as a problem of supply and demand. And as a behavioral scientist, we think about the demand side, like why do people want drugs, right? And other substances, and how do we prevent that, and treat that, and using counseling and prevention and medication. So the supply side is just a big problem, and unfortunately, I think that just in our in a capitalist market here in the United States, companies are incentivized to make products that are addictive and appealing, and often those products that are addictive and appealing will be those that make people feel good in the short term, but aren't good for you in the long term. And I think this is extending to digital media products, social media. I know I've fell prey to spend, looking at my phone probably more than 40, 50 times a day. So, we have to be thinking about that. And regulation is a tool, a policy tool that we can use to kind of stem that, right? And so vaping, I hope that we'll eventually catch up to it. We'll make vaping less common in the population, but there's going to be another one, and when I say also, like, the manufacturers, the sellers, the people who are marketing these products, it can be legal or illegal, right? The cartel is also a business, and they have a bottom line. They want to make money too. So I think if we just kind of think about that as on the supply side, what can we do about addictions? And also I alluded to this earlier, but food, right? These are all just addictive products that are causing big problems for us as a society, and they're fun, but they're just aren't good for us in the long run. So to the extent to which we can work both supply and demand as kind of behavioral health professionals, and I really like that you ask about, how can you connect with the local policymakers and the national policymakers. I think that has a possibility to make a very large effect.
Great. Yeah. Well, thank you so much, Adam, for spending your time with us today. We really appreciate it. I know you're a busy guy, and it's just been great for you to carve out some time to talk with us in Colorado about your experience with youth vaping.
Well, thank you.
We'll connect again soon. Yeah.
It was an honor, and I think it's wonderful that your center is doing this, and you're perfectly poised to lead that. And so, and honored to be the first person, and look forward to hopefully tuning into future webcasts.
Yeah, absolutely. Yeah, thanks a lot, Adam. And on that note, yes, be on the lookout, everybody else who's online, for future prevention extension casts. We will have approximately one a month. And for those of you who would like to connect with us outside of the Prevention Extension Cast, we have some information on how to connect with both the Prevention Research Center and the Colorado State University Extension. You can connect with us if you're a researcher and you'd like to conduct community-based participatory research. Connect with us. If you're a student who's considering graduate school or would like an experience in the Prevention Research Center doing public health and prevention science work, or work with extension, please connect with us. And if you're a community service provider, a local community organization, and you'd like to partner with the Prevention Center or Extension on identifying, implementing, or evaluating programs in your community, please contact us at either our emails or phone numbers. And we also have the websites for both the Prevention Research Center and Extension below. So thank you all. I really appreciate your time. And we will be connecting with you again, sending you a link to this webcast so you can watch it again. And also some supplementary information that you can then download and take to your community partners. So have a great rest of your day. And thank you all very much.
Thank you.
Thanks, Adam.
Sure.